Hi everyone, I want to talk to you about contraception, and this will be the third video on contraception. I've made one on combined oral contraceptives. I have not made anyone on mini pills, which is progestin only. I have made one on male contraception. Please check those two, and I promise that I'll make more. Now, let's talk about intrauterine devices. Is long-term reversible? Well, yes, you can use them for long term. And once you don't want them and you get them out, the possibility of becoming pregnant is very high. What are the types of intrauterine device that's very common in North America and Europe? Copper T, then levonorgestrel higher dose and levonorgestrel lower dose. Who can't use intrauterine device? Generally, any female with the following can't use intrauterine device. First and foremost, if the woman is pregnant, then we are no longer in need of contraception because the pregnancy is already here. Two, dysfunctional uterine bleeding. All we need to do is to find out the cause of the dysfunctional uterine bleeding and embark on appropriate treatment. Abnormal uterine structures, bicornate uterine, no, we can't insert the IUD there. A polygamist, that is a risk for sexually transmitted infection. Even if the woman is clean right now, it's possible there is possibility of contracting STI very soon. Fibroid, depending on the location of it, and pelvic inflammatory disease. That would not be the end. Some other people cannot use a specific type of IUD. Levonorgestrel is not good for anyone with breast CA. And copper T will not be appropriate if any woman is having allergy to copper. And more importantly, anyone with history of Wilson's disease. Wilson's disease is a genetic disorder, a kind of autosomal recessive inheritance, and is common among young people between the ages of 30 and 50 years old. There's a problem with metabolism of copper because ceruloplasmin is low and there will be accumulation of copper in different organs in the body, including the brain. The treatment here is penicillamine for life. So anyone with that type of disease, please take copper off table. Why will any woman choose copper, or which type of women will I recommend copper for? If this woman should not come near hormone, because levonorgestrel on a T structure called Mirena, called LNG, is not appropriate, then I will counsel that the woman should try copper T. If this woman is conservative, if she says, I like to keep my monthly menses, okay, that's good. Or she wants something that is going to last very long. Copper is going to last longer than LNG, levonorgestrel. Or this woman is not sure whether she's pregnant or she's not pregnant. In other words, she's looking for something that could help as emergency contraception. If she has been sexually exposed and unprotected in the last 3 to 5 days, copper T would be the better option here. And of course, she must be monogamous and no pelvic inflammatory disease right now, because copper on its own creates inflammation. And when you add that to pelvic inflammatory disease, then you are doing more harm than good. Why will any woman be advised to take levonorgestrel? If there's bleeding dyscrasia in this woman, levonorgestrel would be the better option because it decreases bleeding. As a matter of fact, it can even lead to amenorrhea. If there's wheezing disease here where the usage of copper is contraindicated, then levonorgestrel will be highly welcome. Or if this woman says, I don't even want bleeding, I hate it, then it is not going to be copper because copper will make her bleed, while levonorgestrel will reduce the rate of bleeding and can actually, if it is high dosage, can actually lead to amenorrhea. If this woman has been diagnosed with endometriosis and she's having pain and she needs IUD, levonorgestrel is the better option. Dysmenorrhea has been the problem of this woman for months or years, and now she has decided, okay, I got to do something. I got to get IUD for contraception. It's not going to be copper. It's going to be levonorgestrel. And of course, she must be monogamous and no pelvic inflammatory disease. How do they work? Copper T has toxic effect on sperm, therefore destroying them. It decreases implantation. Therefore, even if fertilization takes place, there won't be growth. Decreases movement of the sperm, that it will prevent fertilization as a result of no contact between the sperm and the egg through the fallopian tube. Levonorgestrel, on the other hand, decreases motility, makes the cervical mucus to become thickened, making it difficult for the sperm to pass through. It also decreases implantation. What are the advantages of levonorgestrel, that is Mirena? Levonorgestrel lower dose is useful in nulliparous women, and in nulliparous women can have that for 3 years. Levonorgestrel failure rate is about 0.2%. Imagine that, 0.2%. By the way, I need to declare that I'm not speaking to represent the company that manufactures levonorgestrel, Mirena. I am presenting these facts purposely to help many people who will be making choices. So I'm not for copper, I'm not for levonorgestrel, and I'm not against levonorgestrel, I'm not against copper T. Levonorgestrel reduces bleeding, can even lead to amenorrhea. I've said that earlier on. Levonorgestrel is good in preventing endometrial hyperplasia, hence decreases rate of fibroid. Levonorgestrel, though is expensive, but you only spend the money once for 5 years or 3 years as the case may be, and is effective up to the rate of 99%. Pregnancy can follow not quite long after removal. How about copper T? Do they have any advantages? Yes, of course. Failure rate is between 0.6 to 0.8%, though higher than that of levonorgestrel, but comparably to other forms of contraception. That's not bad. And it stays up to 10 good years. 10 good years, a decade. Pregnancy follows immediately after removal and is not even expensive. For emergency contraception, yes, it's far better than levonorgestrel. It is very useful when hormones are contraindicated, like in the case of breast CA. So we are privileged to have two things to select from depending on the situation. And copper disrupts fertilization. And when there's no fertilization, there won't be any growth of morula to embryo and to fetus. So no pregnancy. Disadvantages. Nothing else merits without demerits. Copper T expulsion is about 6%. Possible that pelvic-inflammatory disease will increase. On its own, it causes inflammation. Allergy to copper is very common. Wilson's disease, like I've explained, a genetic disorder common among younger age group, 30 to 50 years old, having problem with metabolism of copper, and then copper is deposited in so many organs, including the brain. Ceruloplasmin is low and is autosomal recessive, and the treatment is penicillamine for life. If that is the case, that's a big disadvantage. We can't use copper here. And there's possibility of uterine perforation that might warrant surgical intervention. Levonorgestrel could also have expulsion as far as about 4%. Uterine perforation is also possible here. Ectopic pregnancy is possible if pregnancy should occur by any means. There is possibility of increased weight, and failure rate is about 0.2 to 0.33%. It is expensive. In conclusion, IUDs are good if it is correctly chosen, like I've itemized under particular condition or conditions when you can choose a particular one for a particular woman. But it depends on the interest of the woman also, anyway, because we are not going to force anything on anybody. So IUDs are good if it is correctly chosen and the woman keeps away from all sources of sexually transmitted infection. Please report any uncomfortable feelings to your doctor. I am sincerely wishing you a sound health. Watch out for my other videos on all the rest types of contraception. Thank you.